There we go. Hello and welcome to our webinar. Our special guest, Dr. Tom Tully, will be with us in a moment. So let's wait a little bit, let people log in so we can all get on the webinar together. And in the meantime, I thought, who doesn't like a poll? Especially who doesn't like a poll about birds? So this is my first time trying the poll option on here. Let's see how this goes. Across some of my fingers, I'm going to launch the poll. And I want you all to answer, if you can, answer honestly, because what's the purpose of the poll if you don't answer honestly? All right, so which best describes your bird at the vet? My bird loves the personal attention. My bird tolerates the personal attention. My bird has to be extracted from the travel carrier. Have the towel ready because my bird, oops, sorry. Oh, my bird, it got cut off. My bird is ready to rumble. So the birds, you know, the birds that might not like all the personal attention. That last question is, sorry, it got cut off, but have the towel ready because my bird is ready to rumble. And by the way, I don't know about you, but I am always impressed when I go to the vet on how effortlessly they can tell a bird. I wish I was as adept at that as they are. So kudos to you guys for being able to handle birds so well. Ooh, okay. So I'm going to give time for people to answer these questions. Sorry about the last question. It's cut off in case you're just joining us, but it does say have the towel ready because my bird is ready to rumble. And it's a kind of a, actually an interesting mixture of answers so far.
Really?
Yeah, I will end the poll in about, let me see here. Let me give it another go for people to be logging in, but so far we have a good bit of, ooh, there's my bird tolerates the attention is now taking the lead. That's good. That's good.
I like those.
Yeah.
Those are my favorite patients.
I'm sure you've had a couple of my get towel ready because my bird is ready to rumble. I know my Amazon was like that. Okay, so I'm gonna give us another 10 seconds. Everybody get their answers in, and I'm going to end the poll and see what the results are. Okay, here we go, end poll. Can you guys all, I'm going to share the results here. Okay, so, well, we do have some people whose bird loves the attention. That's good. And nice to see that some birds tolerate the personal attention. They must be knowing that you brought them in because you love and care about them. My bird has to be extracted from the travel carrier. I don't blame them because it is an experience that's a little bit something they don't have every day. And then have a towel ready because my bird is ready to rumble. Yeah, they are you know, prey species, so you can't blame them for that.
Well, even if you practice fear-free, which we all try to make it as fear-free as possible and always have, we do have most of the owners are there right away and saying, my bird bites. So they at least prepare us to be careful. And I appreciate that. And I do realize that they do bite from time to time, and that it is somewhat of an unusual and scary situation for them. So we do everything possible with that and try to make it. And there have been many advances, even with some of the sedation, to try to reduce the, I guess the scary experience for the birds. So,
well, there you go. So when you take your bird to the vet, if you give them a little bit of a heads up on how your bird might be with the visit. All right. So I'm going to close the poll. Thank you guys for answering that. And so hopefully we have everybody on. So I'm going to kickstart this webinar. So welcome. My name is Laura Doering. I'll be the host today. And our webinar is Ask the Vet, a Q&A with Dr. Tully. Dr. Tom Tully. So since we are doing a lot of Q&A during this webinar, a reminder to use the Q&A button at the bottom of your Zoom screen. not the chat button, but the Q&A. So we want the questions coming in through the Q&A option, so we can keep a better hold on that, because I'm sure we'll get some get a good amount of questions today. And if your question isn't answered today, still we will capture that information, and you will be getting a link to your question with a reply. We are able to capture that and email you an answer at a later time. So we will get to hopefully most questions that are asked today. So now on to our guest, Dr. Tom Tully. He is a professor in the veterinary clinical sciences department and section chief of the Bird Zoo and Exotic Animal Service at Louisiana State University, LSU, School of Veterinary Medicine. Dr. Tully is a diplomat of the American Board of Veterinary Practitioners, Avian, and the European College of Zoological Medicine, Avian. He is also a recipient of the TJ Lafeber Practitioner of the Year Award. So that is saying a lot right there. So Dr. Tully, thanks for being on with us today, and welcome. And let's see what you have to say. If you can give us a little bit intro about, basic bird care, about what to expect on vet visits, and then we'll dive into Q&As.
Okay. Well, thank you very much, Laura. And it's a pleasure to be here and talking to everybody about bird care, and to try to answer some questions that you may have. And I always am trying to do everything possible to inform and educate the bird owner, to try to make it what I would consider a great environment and experience for both the bird and the owner. And the more information that you have, the better chance you have of providing an environment for that bird, and also, or birds, and that would include nutrition, so that animal or those animals can live long, happy, and healthy lives. It's all about education and information, and if you ever have any questions, you need to ask, and it's always good to ask a knowledgeable source. I always say that I enjoy and I encourage all of my bird owners, for the birds that I see, to get as much education and information as possible. I encourage those owners to seek the internet. The internet's a great resource. And then if you don't understand, or if you question what you may see, and then that's where you should ask possibly a health professional, your veterinarian, or somebody that may know in particular about that particular issue that you have a question about. A couple of things that I want to start off this webinar with is some of the information and some of the more common issues that we've seen and problems that are associated with the patients that we treat here at LSU. One is nutrition. Nutrition is extremely important. It's like what you eat is what you are, and it also helps maintain not only the health of the animal, but also the future health and the longevity of that animal itself. And so that could also relate to reproductive activity if you're seeking to reproduce those birds. I always think diversity. You always want to have a diverse diet. I think that the diverse diet, and when you're looking at that, you're thinking and providing psychological benefits with a diverse diet. Also, foraging. Foraging is also a psychological activity that stimulates that bird above and beyond the nutritional intake that bird has. So there's many aspects about nutrition that are above and beyond just putting the food in the enclosure. And so one of the first things that I had, and kind of gave me some ideas of what the birds can do as it relates to nutrition and how it benefits those birds through not only the diversity, but also the foraging. I was down in Puerto Rico, and they had it was at the Puerto Rican Amazon reproductive facility where they're trying to breed these birds to put more of those Puerto Rican Amazons back into the wild and replenish the population that has diminished over the years. And I was looking at the diet, and the diet was very diverse, and one of it was they had these Amazon parrots that weigh about 300 grams. And they had specifically the seed mixture that they were providing them. And they were not only providing them seed, but they had a pelleted mixture. They had pellets, and they had vegetables. And of course, in Puerto Rico, you can have all of these tropical fruits that grow right outside of the place and the aviary. And so they had millet seed. And I said, millet seed, a 300-gram Amazon? And the person who was the caretaker of the aviary said yes, and the birds eat the millet seed. And so it was one of those things that if the birds will eat, you have to, with this, like a seed mixture, they're going to eat what they like. I can tell you my Derbian parrot, if I had a seed mixture, he had his favorite seeds that he would eat out of that mixture. Wouldn't go to the pellets first. He didn't go like say, oh, I want that red pellet. That's what I want first. No, he would go to the seed mixture. But after he would eat the seeds, then he would eat the pellets. So each bird is a little bit different, but it's that diversity. And you can see that with it's both psychological and nutritional. Also, when you have health exams, people say, well, I'm going to go and get my bird examined. It could be a health exam just on a basic, I've never had the bird examined before, it's a new bird, or there may be a particular problem. Well, what we can look at on a health exam is external abnormalities or normal condition. That's all we can see externally. We cannot see anything internally unless we do other diagnostic tests. The diagnostic tests have to be specific in what you're looking for to try to determine the overall health of that animal. So if I'm trying to see what's going on inside, if there's no fracture or there's no mass or something, there's really no need for me to do radiographic imaging or any type of advanced imaging, diagnostic imaging. But it's the same as if you go into your physician and you get a physical exam. The physical exam, the physician may look at you and feel and say, you know, take your heart rate and listen to your heart, your lungs. But what's at the end of that exam? Oh, you have to go get some blood taken. Why do they take the blood? Because the blood will show them what's going on inside. So a physical exam is not complete unless you have blood testing. And that tells what's going on inside of the patient. Now, you can get by with not doing it, but there will possibly be chances that there's something missing. I can tell you one example of this, hyacinth macaw. Hyacinth macaw went in for a physical exam. Bird looked great. Physical exam included blood work. Well, the normal red blood cells within the bird is usually about 50% of the blood volume, about 50%. This bird had 12%. So it was what we call anemic, low red blood cells. And it's 12% is very close to not being really where you have, you can function and possibly die. If that blood test was not taken, there'd have been no clue what was going on with the bird, and it would have died. I could tell you it would have died if something wasn't done for that bird. But nobody would have known anything because the bird looked perfectly good. So I always say, if you want to really know what's going on with your bird when you take it in for a physical exam, it needs to have blood diagnostic testing, at least a complete blood count. Also, what we see is where we have a lot of the backyard poultry, waterfowl, and birds that are outside, and many times it's like you go, oh well, we treat this bird we always treat our birds for parasites, and so we treat them for parasites on a regular basis. We use, the parasite killer drug, kills all of them. Unfortunately, for parasites, one size doesn't fit all. Each parasite is sensitive to a specific drug. So if you give one drug, it may treat a certain parasite, but it's not going to treat, let's say you have worms you have roundworms in the bird. And for birds, capillaria is a common worm that you have, parasite in birds, but it's not going to treat if they have tapeworms or if they have some other type of parasite. So anti-parasitic medication has to be specific. And so that's why if you have birds that treating with a anti-parasitic medication on a regular basis, to me is a waste of time, money, and labor, and that it's easier and probably a lot less expensive to get routine fecal examinations to see if there's any parasites there, and if there are parasites there, to treat them specifically for those parasites with the specific drug that's needed on there. Also, we have our share of behavioral issues. Behavioral issues, I would say, with parrot species is one of the most challenging cases that we do see. First and foremost, we want to make sure if this behavioral issue is associated with any medical issue, a disease condition. We have to do our due diligence that it is, in fact, a medical issue. I have been told before by an owner when I went through this whole process, it was I think it was a yellow-collared macaw, and it was a few years ago, and the bird had plucked all of its feathers from the neck, down. And so I went in and I said, well, we need to see why the bird is plucking the feathers out, and we're going to need to examine it and see why it's doing that. And if we can treat it medically, then we don't have to say and assume that it's a behavior issue. Well, the owner said, well, Dr. Tully, we know why it pulled its feathers out. And I wish that every time somebody brought in a bird that they would say, we know what's wrong with it. We just need to treat it. And so I said, well, what happened? And they said, well, about 6 months ago, they had the bird for a number of years, and everybody was happy, and the bird was happy, and so they brought home their baby from the hospital. And they said they brought home the baby, and the next day the bird's feathers were all plucked out. And I said, well, that was 6 months ago. Well, we brought home, and he said, well, the one thing is that the bird got used to the baby, and the feathers grew back. but last night we brought home a dog. And so there was an issue with this, obviously with this bird, where there was a cause and effect. Anytime they would bring somebody into their house that the bird was not aware was coming in and nobody got its permission, it would just pluck out its feathers. So we had to deal with that. The behavioral issues are difficult because it's not always that simple. And sometimes even when it's very obvious of what's causing it, it's about how do you resolve that. That's why we have veterinary behaviorists and avian behaviorists that really try to work and make you understand what some of these issues are, where you don't have just a medication that you can give and the bird gets better automatically. And so behavior issues are difficult. And as with anything, it's always better if you have behavioral issues to try to do or behavioral issues can be a problem, that you do everything you can in the beginning to try to prevent those behavioral issues from occurring. And that goes for, in cockatoos, we have cloacal prolapse, where we believe that there is too close of a relationship between that bird and the owner, and that relationship, what we would say, encourages that bird to do behavioral conditions that result in that bird prolapsing the cloaca, and then changing the behavior of both the owner and the bird are difficult. And so it just kind of continues. And then you have also anatomical issues that are associated with it that make it difficult to fix. So anything that you can do to prevent the issues from occurring, be aware of what some of the behavioral concerns are, making sure that the bird is psychologically stimulated. We talked a little bit about that with nutrition, but also that you can do that in a number of ways to encourage that bird to be happy, and also reduce the incidence of abnormal behavior.
So it sounds like, Dr. Tully, that another part of bringing of your bird's health is making perhaps lifestyle changes that on your behalf, and lifestyle changes that might benefit your bird. So it's not just like the situation with the cockatoo, like maybe not making it more of a less of a Velcro type situation. Velcro bird, with cockatoos is a typical moniker that they get, but to kind of see it as not just the physical presentation, but the emotional, the lifestyle changes, just like it is with us, right?
Right. And one of the things, what I always try to, to speak of the cockatoo, I always like the term, and I think I heard Chris Davis say this many years ago, and called the cockatoo a cockatoma. That they want to be physically attached to your body like a tumor, that's a cockatoma. And so I've never forgot that, and they've lived up to that name over the years. But one thing, Laura, is that I always tell the owner that you need to work with the bird to have the bird fit your lifestyle, and not have the bird train you, and to train you into a situation where you're doing what you don't want to do, or that it's overbearing for you. And birds will train you in a second. Birds have an ability to train you and make you do what they want you to do. And you have to be the person that is, or the, you know, the owner, you have, as the owner, you have to be the boss, and you have to work to train the bird how you want the bird to behave. And that's operant behavior training, and making the bird do what you want it to do, but it's happy to do it because it thinks it's doing what it wants to do, but actually you're training the bird. And so that's how they get animals to come up and put out their, like primates, to put out their arm to collect blood, or dolphins, porpoises to put out their flipper to collect blood, because they train them that way. And birds can be trained this way. Birds can be clicker trained. That's been known. And so you can get, and they're smart. They're smart animals. And I think you may have had Dr. Pepperberg or whatever, or some other behaviorist on this before. But the intelligence, we know what the intelligence are. That's why they can train us, because they're smart. But we have to take the upper hand and be able to train them, so that when we train them, that that everybody's happy within the house. Because if an owner isn't happy with the bird and getting the most out of the bird and the companionship qualities that they seek, then that's not good.
Good point. Good point. Wow. I'm going to move on to the, I think we'll move on to some of the questions we've got. I see them popping up here. Those are very good points, though, that we can all learn something from. I think that's very valid. So we have a question from, let me see here. Get the name on here. Okay, Maria asks, should imaging of the, oh boy, I hope I don't miss the words here, mispronunciate. Should imaging of the colonial papillae be a standard part of an avian exam in order to check for vitamin A status? Only 1 out of 4 avian vets I've seen has checked the
choanal papilla.
Thank you. For blunting. And I know it's not a mainstream practice, but is there a strong evidence for the appearance of the choanal papillae reflecting hypovitaminosis A?
Well, as that should be part of a routine exam for a bird, because this is not only an area that there's a claim for hypovitaminosis A, but what and along with the choanal papilla, what we look for hypovitaminosis A also is the bottom of the foot surface, where you should have the little foot pads, and it should be smooth, and you should have the little bumps on there that are typical of a parrot foot or a bird foot, but in particular parrots. And so we look for that. If it's smooth, then that may be, or thickened, that may be an indication of hypovitaminosis A. Very rarely would I, and I can't even remember where I have seen a hypovitaminosis A bird recently with a blunted choanal papilla. But you look at that choana mainly, for upper respiratory conditions. And if there's a chronic upper respiratory condition, those choanal papilla will be eroded or blunted, and the choana, on the upper roof of the mouth, it's the oral nasal interface. And what that'll do is that with the irritation and inflammation associated with the upper respiratory condition, will blunt those papilla, and it will be inflamed and possibly swollen. So, and just saw a bird last week with that. And it was not an obvious nasal discharge, but it did give me some indication that there was some chronicity, and it did back up what the owner was seeing. And this is all part of a normal physical exam, and it can tell you more than hypovitaminosis A, and in particular, upper respiratory infection.
Okay, thank you. I also have a question, let's see, from Nancy. She asks, please explain the difference between bornavirus and what used to be called PDD. And what's the difference between Borna ganglioneuritis and a diagnosis of ganglioneuritis?
Well, very good, Laura. I got the gist of that for sure. I did. But we'll go with the ganglioneuritis, you know, and that, and Lord knows I have difficulty saying it myself. But at this point, what is you have proventricular dilatation disease, and that can be identified if a bird is suspect and dies from it. It can be or dies from it. You can look at the pathology from a biopsy, which is easiest done by a crop on a bird, but if a bird dies from it, you can see the pathology that's associated with the disease on the necropsy, and they can look at the tissue sections just like they do a biopsy, but they have a better chance of looking at more tissue, and they can identify it and make a diagnosis based on the pathology. And bornavirus comes into play because there is a suspect that this is has a role in the disease condition. There are birds that have died from proventricular dilatation that have been diagnosed through pathology, that there was no evidence of bornavirus being there. And then there's birds that have not actually come down with the clinical condition or the disease condition of proventricular dilatation disease that have been identified with bornavirus. So how bornavirus may or may not be involved in this, at this point, we do not have all of the answers. And that's very typical with medicine, as you can see with this COVID. Every day there's new ideas and information coming from this coronavirus infection that we're dealing with now as a pandemic. It's the same with bornavirus. We don't have everything, and for somebody to come out and say we do, I think that's not not totally true. And I think that the more information that we get, and the more we'll be able to understand it. But at this point, there seems to be a connection. We just don't know what that connection is at this point, because many birds that do have proventricular dilatation have been identified with bornavirus. And so that's my take on that. Does that kind of answer the question?
Well, I think it does. That's what. Let's see. Well, our next question comes from Liana, and she writes that our local vet, who isn't an avian specialist, said she was hesitant to do blood work due to the small size of a white-winged parakeet. What sort of blood testing should I ask for when seeing an avian vet? Is it painful for the bird? And how do we make sure that they stay still?
Well, that's not, and who asked the question?
Liana.
Liana, that's not your job to make sure that they stay still. That's the veterinarian's job to make sure they stay still. That's a good question, because when you're talking about parakeets and you're talking about budgies, you're looking at 30-gram birds, you're looking at parrotlets, you're looking at maybe 20-gram birds. You can only take 0.2 ml from a 20-gram bird, 0.3 ml from a budgie. And so when you have some of your smaller birds, you can only collect so much blood. And of course, the more blood that you would like to take is going to be dependent on how healthy the bird is. So if you have a 100-gram cockatiel, you can only take 1 ml of blood on a healthy bird. And so the collection of blood is kind of correlated to your experience. And if somebody isn't experienced at collecting blood, I like the truthfulness. You should be happy with your veterinarian that they will tell you this, because you don't want somebody collecting blood on a smaller patient that doesn't have the experience in collecting the blood. If you need to have a blood sample and you would like to know what the condition of the bird is, then possibly they could recommend somebody that would be able to collect the blood. And you may say, well, I live somewhere where I can't. If you don't have that information on a sick animal, as you can well imagine, that's going to reduce your ability to really know how severe the disease condition is, or how well it's being treated. But we collect, and of course, I have a lot of experience in collecting blood from patients, and it is something that we do on parrotlets on up, and canaries or what have you, and we utilize that, and we have the in most diagnostic labs will tell you how much they need, and they can run blood samples on that. But you have to have somebody that has the knowledge, the experience, and the confidence to be able to collect the blood. And like I said, it is something that's good where somebody says, hey, I don't feel comfortable with it. And then that gives you the opportunity to ask, well, do you know somebody that may be able to do it?
Yeah, referral is it, right?
Uh-huh.
Okay, so I have a question from Joanna, and she asks, can you show the most common cause of parrot death in your experience?
The most common cause of parrot death in my experience? Well, that's a good question, because
well, would you attribute to disease or trauma?
Yeah, I would say infectious disease. I would say bacterial, fungal, and this would go across the board with any of the birds that we treat. It's infectious disease, and I would say that either bacterial or fungal or viral, that would be the most common cause of death in parrots.
And is that something that could be potentially caught during an annual exam, those kind of things? Or?
Yeah, usually in an annual exam, what's beneficial about an annual exam is that we learn so much information over the year. Avian medicine is continuing to increase with our knowledge, just like I talked about the Borna, we had the question about the bornavirus. 15 years ago, we didn't even know about the bornavirus, and proventricular dilatation disease, and so with the nutritional advances, with the medical advances, the annual exam gives you a chance to actually get more information and learn more about your bird. That's the one of the biggest benefits is education and information that you should be receiving from your medical professional for your bird. As far and so that's, you know, as far as the CBC, yes, the CBC can in particular can tell you. We have had birds, particularly African grays, where we have a bird that has a fungal infection, and the bird looks normal, but it has a 70,000 white count. Okay, so normal is 15. I say just in general 15 is the normal mean, and the bird has a 70,000 white count. But if you look at it in the cage, don't have any idea. But I will tell you that they say birds don't have a you know, they're prey, they're prey species, and so birds hide their clinical signs. And I kind of am not really, I don't really support that too much. I believe birds show if they're not feeling well. They're not going to say, "Hey, look, I'm sick. You know, I'm not feeling good." Although they may, but if they, you know, if they can vocalize like that. But for the most part, a very astute owner, they'll come in and I can look at the bird and I'll say, "Oh, it looks good." And the owner says, "Doc, bird's not doing right. Bird's not doing right. It's not 100%. Something's wrong with that bird." And so birds will have clinical signs, and usually the clinical signs, when you have an infectious disease, you will see the clinical signs. There will be something there, but there is the very distinct possibility that you would pick up something like in an African gray an abnormal but white count that would be indicative of an inflammatory response. But that's, again, you also are, while you're doing this on a yearly basis, you get an idea of what normal is. So if there is something that is problematic, that you have some history to look back on in the files, just like your physician does when you go in for your exam.
Good point. This next question comes from Julie. She asks, do you have any suggestions in terms of parrot-safe materials for toys? Specifically, do you see any problems with ingestion and GI or respiratory blockages due to paper, plastic, cork, wood, fuzzy fabrics, such as polar fleece in parrots that you have cared for or read about?
Yes, kind of all of the above. And so there is no, and I have had the excellent opportunity to go to a number of bird fairs and see the toys that are there. There's not an oversight committee or association that gives some type of a parrot seal of approval for safe toys. What I've noticed is that most of the toys we've had, some of the cotton rope, anything, you want to make sure that you always have parrot specific toys for the size of bird that you have. You don't want to give your macaw a budgie toy. You don't want to, so you want to make sure that it's parrot specific. But the one thing that you want to be very careful about is what you provide. And so anything that you want to, some of the wood is good. I haven't had any issues with some of the wood toys. Will birds ingest wood? Yes, they will, but that's not something that we normally or commonly see. Some of the more problematic things that we've had over the years are the ropes, the cotton rope, the soft cotton rope that the birds will fray, and that they will ingest that cotton rope and become impacted. Any of the plastics, anything, any plastic isn't good, I don't believe, whatsoever. And for any bird that can chew it. And I think that could be, again, we've seen that. And of course, you don't want any electronics or anything like that. So you want parrot-specific toys, the wood, anything that they can chew. They like to chew wood. And again, you want to make sure that they have something in the cage that is psychologically stimulating. And I think that's good. Toys that are made for humans aren't good for parrots, and I've seen where that's been put in and made into parrot toys, and I think that's problematic. So you want to get parrot specific, bird specific toys for the size of bird that you have, and try to maintain that as wood, or have blocks and different things like that. That's very helpful.
Well, before I get to the next question, I just wanted to ask, would a bird have any clinical sign? Like, what would be a sign that it's ingested something that's causing a blockage? Would it present to the owner in any certain way?
Yeah. They would be lethargic. They would have a depressed attitude, and they would not be eating. And so that would be, and they're not going to be specific. And if there is a blockage, they wouldn't be urinating or defecating either, for the most part. Unless there was a partial blockage, they may be urinating. But they wouldn't have any fecal material within their stool.
Okay. So Linda asks, my friend had a cockatoo who ate a piece of wood, and on necropsy, they found dust in his air sac. How common is that? They
found what?
Dust.
Dust?
I'm guessing wood dust. The cockatoo ate a piece of wood, and on necropsy, they discovered dust in his air sac. Is that associated?
Yeah, that wouldn't be common. And like I said, I had mentioned I know that they will ingest. I know that birds will ingest nest material from the nest box from time to time, but that's highly unusual on that.
Okay.
And I think that then when you look at it, and cockatoos can tear up some wood, I can tell you that. And as most people know, that it would be, I think that the risk versus what you're looking at, where you're going to just keep stainless steel things in there, I don't think that that's going to be as beneficial.
Okay. Tammy asks, I have a 13-year-old Quaker parrot who weaves skewers in and out of the cage bars. When he was around 5 years old, his lower beak began overgrowing. I need to take him to the vet once a month to have his lower beak trimmed. Is he healthy? Blood work always within, he's healthy, blood work always within normal. So the question is, have you ever seen the lower beak overgrowth before that did not begin right at birth or hatching?
Yeah, beak growth is usually related specifically to the normal occlusion of the beak. That's what's going to keep the beak in a normal growth pattern, just the normal occlusion. Of course, that they can exercise the beak outside of the normal occlusion, biting different things, but it's not like you can put in a beak oh, well, this is going to keep the beak lower. So it's normal occlusion. So if you have a bird that is hatched and has a malalignment of the beak, the upper and lower beaks, then what you're going to have is you're going to have abnormal growth rate. Now, this can occur later when the bird's older, when the bird, if the bird traumatizes the beak some way, flies into the cage or what have you, or it flies into the wall or whatever, it can kind of offset the beak a little bit where you don't have the normal occlusion. And so one of the issues is that usually if the beak fits, the lower beak fits under the upper beak, it'll keep it short. But if it's in front of the beak, of course, it'll grow longer. They call that prognathism, when the lower beak's longer, and so, or out in front of the upper beak. And you always want that, of course, the upper beak out there. So that can occur when the bird is in development, or this can, and that's usually when, and cockatiels and cockatoos have this problem a lot more than other birds, where the upper beak's in the lower beak. But for the most part, any bird can have it, but it's trying to resolve that. And otherwise, it's probably an occlusion, an issue with the occlusion of the beak than the anything else.
Okay, thank you. So Eileen asks, my crimson-bellied conure does not have a producing oil gland. Is there anything I can do? Thanks for your participation, Eileen.
Yeah. I'd say, is it, if it doesn't have a preen gland, certain birds don't have preen glands. And so, Amazon parrots, for instance, don't have a uropygial gland. So with that, the one thing that I would say is that if you just have it on good nutrition, that it shouldn't really cause much of an issue.
Okay. Let's see if we do have some more questions. We probably getting a little bit close to the end here, so I'll see if we have a couple more questions to answer.
Time flies when you're having fun, Laura.
It does. That's a good point. Yes, it does. Let's see what
no
we got.
No pun intended, right?
Okay, here we go. Stacy asks, there was previously awareness of vaccine towards bornavirus. Where are we with that at the moment? Is this something that is likely to be available in the future? And where are we on the development of a vaccination for the bornavirus?
Okay. No, and no. How's that? Is that quick?
That is to the point, yes.
Well, no, just for some explanation, there's a vaccine that's available for cytosine beak and feather disease right now, but it's not on the market. To get any vaccine approved takes, let's just say, in the neighborhood of, from what I'm to understand, $1 million to $2 million to get it approved. Okay, a commercial vaccine. You need a company that's going to actually go through the process to get a vaccine approved. And at this point, there's no vaccine that I'm aware of for bornavirus. And I don't know of anybody that's actually working on one because of the I guess lack of total information we have on the bornavirus and how it's involved with proventricular dilatation disease. But even if we had a vaccine and we said, hey, proventricular dilatation disease is caused by bornavirus. We need a vaccine right away. The problem is that there's not a company out there that would pay the money to actually have it commercially produced, because they wouldn't be able to get enough return on their investment for that in the pet bird market. And that's why we don't have, when we do have a beak and feather disease vaccine, and that's still around, available, but nobody has the money and will produce it commercially to get it on the market. So that's the predicament we are in as pet bird owners. I'm in as a pet bird veterinarian who would love to have a vaccine to prevent some of these disease conditions. We have the, I guess, the research capabilities to produce these vaccines, but we just don't have the players in place to bring them to market, because they don't get enough return. They wouldn't get enough return on that. And that's disheartening for me.
Perhaps that's a reason that, you know, if it is possible to contribute to avian research, you know, there's some grants out there and stuff if you can find them. All right, I think this is our last question from Joanna. She asked, do you know of any case that the parrot beak prosthesis has remained permanently?
No, that's a good question, but no. And you never know how long a prosthesis, beak prosthesis, will remain in place. It can remain in place for 5 seconds after the bird recovers to a number of months or maybe years. The problem is that you have the beak, which is a very dynamic part of the anatomy, and the bird is trying to eat and prehend food and chew food, and so what you have is of course, an inanimate object on viable tissue. And so what happens over time is that this wears, and as it wears, and then it over time, because pressure is continually being placed on it, then it's going to displace. And so it's not going to be permanent. Now you can keep reapplying and the bird can do better. Now we have had a number of birds that have had their upper beaks just bit off. And so there's nothing there. And they just have the lower beak, and we have to trim it down. But the birds recover and do well on a liquid diet, or you can either grind up pellets and they'll eat those, or baby formulas. But those birds adjust and adapt well and live just like any other bird. And we can guarantee, Laura, that those birds will not bite you.
Very good point.
But I can tell you is that we place prosthesis on bird beaks, and I know it's just something that you can guarantee that they will eventually break down. Hopefully after a long period of time, but they will. Okay. Well, I think that would be our last question for today because of the time. But just to let our participants know that if you did not have your question answered today, we will get to that, and hopefully early next week we'll send you an email with your question and an answer. So thank you for everyone who logged on today. Dr. Tully, thank you very, 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 very much for being our special guest. Hopefully we'll see you back soon. Get back maybe some more vet questions, because we still have a lot that people definitely have questions. And so appreciate you taking the time with us today. Hopefully we'll see you back soon. And well, thank you.
Thank you. And just to let our viewers know that we will have another webinar next Friday. and we'll be with Dr. Stephanie Lamb. You might remember her from our first 2 webinars. And she's going to be covering a pretty timely topic, which is spring is in the air, how to deal with your pet bird's hormonal behavior. So tune in for that. We'll have that on our website, the information about signing in. And just want to thank you, everybody, for participating, everyone for joining us today. So until next time, stay healthy, stay safe, and all the best to you and your flock. All right. Thank you, guys. Thank you, Dr. Tully.
Yeah, thank you, Laura. Thank you, Lafeber. Thank you. Yes, thanks, everybody.
Bye.
Bye.